Dr. Claytor here today, share with everyone neck rejuvenation with the MIMS procedure. What does MIMS stand for? Minimally Invasive Mastoid Sling. It's a lot of words, but let's break it down. Minimally invasive, that's what everybody is looking for. Give me a great result, doctor, with very few incisions. So making a very small incision back here behind the ear is all I need to do. That allows me to go in and infuse this with fluid. We call this tumescent fluid. So you enter in with a cannula and you infuse fluid into here between the skin and the deeper structures, and it's a saline mixture with a little bit of epinephrine and a little bit of numbing medication. And the whole time the patient is awake. They're wide awake during this entire procedure. So we put this fluid in here, and then we come back with liposuction. We go in just through there and we get out underneath the chin here and we liposuction out the fat. So the muscle is down here and this whole area is fat. So we go in and we evacuate that fat. Then we come in through the same small incision and deliver some sort of heat energy. It can be a laser technology. There are lots of ones out there. I don't want to promote any one over the other. The point is a little bit of heat energy, not too much, because too much heat energy on this tissue can turn that tissue into leather. You don't want that. You want it to be nice and soft. Now comes the amazing part, which is delivering a suture underneath the tissue to now take this loose skin envelope and draw it back up to the underlying muscle and neck structures. This is what is the magic with the procedure. So we enter here and we slide it up underneath the skin until we get up back behind the ear. Now, if you take your finger and touch back behind your ear, that bone there is called the mastoid bone. So over top of it is fascia, or a tough layer of tissue. So if we make an incision there and we go right down to the bone and then we shimmy along right on top of the bone, we're underneath that fascial layer. And then we pop up to bring the suture out from underneath there through the skin. And then we drop down through the skin again, but now we're staying on top of the fascia, but under the skin. And so we have created a sling around that piece of mastoid fascia. So now this is my anchor point, and that anchor gives us the ability to deliver a strong suture pull in this direction. As we tighten it, it pulls it this way. And so as we go over here, here's that patient afterwards. There's that little incision. Underneath the skin is that suture that goes all the way down to here, turns around, comes back up here again. And that's where it goes around that sling up underneath the tissue. By doing that, I'm able to pull this way. I'm able to pull that skin envelope in to create this beautiful tight jawline. There are a whole bunch of other things that I do. That's a permanent suture. We also layer in absorbable sutures, so it makes it really quite wrinkly up underneath here. That's on purpose by design, because that's going to add a little scar tissue to tighten it up. On top of that, we put sutures over top, which are called the hemostatic net sutures. That it's like a quilt, and it pushes that tissue, the skin, down to the deeper structures so that it sticks. We leave those for about 2 to 3, sometimes 4 days. Then we take those sutures out, and everything else underneath, that stays. This one big suture is permanent, and it stays forever. Many patients will come in and say, how long is this going to last? That is designed to last forever. The other sutures that are absorbable, they last about 2 to 3 weeks, and they are also aiding in that tucking of the tissue and bringing it in and creating that beautiful contour. Those sutures will dissolve and go away. That's what allows that little bit of puckering to disappear. If the tissue stays a little bit irregular, we can add in something called microneedling, and you can microneedle on top of that, and it helps soften it up. So, minimally invasive mastoid sling, which is the MIMS procedure, to deliver this kind of long-term permanent result, all through a tiny incision back behind the ear. The MIMS procedure. Dr. Claytor, I hope you found this helpful. Thanks.